Under eye botulinum toxin injections. Why would you inject the eye here and why would you not? This is a really popular question many clinicians have been asking us, and it's for a very important reason why I think it comes up. Patients are often asking for treatment here to get rid of fine lines and wrinkles, but there are also other things you can do in this area, which I'll be covering in this video. The most important thing to realize is that it is not a straightforward area to treat, and you need to know which patients to select, which patients to deselect, and what the side effects and risks are here before you even think about doing it. So firstly, why on earth would you ever even inject under the eye? There are a number of different indications, the most common of which is probably just fine lines and wrinkles, but you can also treat something called a jelly roll, which is to do with compression of the lower eyelid by the contracting orbicularis oculi muscle. And you can also widen an eye in certain people. So first, let's think about treating the under eye for fine lines and wrinkles. Now, this is a really common place for patients to request treatments, and I'm afraid it's not usually a great result using botulinum toxins, but there are some exceptions. You first of all have to break down the type of line and wrinkle that you've got, because some people have a line under their eye that bugs them that is actually a normal structure in the eye, a bit like the lines you have on your hands. It's meant to be there and it's not a crease. So firstly, don't get into treating those. You will see these even on children sometimes, that they have a line under their eye, not solvable with botulinum toxin. The next is that you develop fine lines and creases that are there only when the zygomaticus muscle is contracting. So it's predominantly caused by the skin underneath the eye being compressed by the big muscle in the cheek as your cheek raises up. This also is not going to be cured by using botulinum toxin in the inferior part of the orbicularis oculi muscle. So when would you actually treat this problem? For me, the criteria is around clear contractility or hyperactivity of the muscle that's separate to the zygomaticus muscles. So you'll sometimes see patients with activity in the muscle that causes lots of fine lines and wrinkles, and it tends also to go with a little bit of volume loss. Now, these patients sometimes get a very good result in other ways too, and it's worth being aware of those. For example, I'll never forget one particular patient who complained with lines underneath her eyes. We did a full face treatment, and as I was treating her cheek, we got a really dramatic improvement in the crinkled surface underneath her eyes, and that's simply because pulling the skin here caused a little bit of tightening underneath the eyes. Now, this won't work on all your patients, but it's useful to think about what is causing these lines, because volume depletion can be directly underneath the skin, but it can also be lateral in the cheek, and this muscle is then pulling against what is now an emptier space due to aging. So replacing volume around the cheek can sometimes improve the orbital lines and wrinkles considerably. But it is these patients who may get a benefit from botulinum toxin, because if the muscle is constantly active and you drop a tiny amount in, it might just make it more relaxed at rest and having less of those fine lines and wrinkles that are just persistent when they're not smiling. So this next injection is weird, and it's not in quite the same place as what we've been talking about. In the first half of this video, we've really been talking about the palpable part of the lower eyelid, but the next part is still underneath the eye, is the orbital part. So the orbital part of orbicularis oculi, if it's relaxed, can actually make the eye look rounder. And this is particularly popular in Korea and the Far East, where some people believe a rounder eye is more beautiful. Unlike in the West, where we actually quite like almond-shaped eyes, which is an interesting side point. But if you were to relax the muscle in the midline, just underneath the pupil, it can create a more round appearance. And this is another reason why you might treat underneath the eye. It's not to resolve lines and wrinkles, it's simply to widen the eye slightly. The next reason to treat underneath the eye is to try and soften a jelly roll effect. So the jelly roll is this essentially skin bunching up underneath the eye when the orbicularis oculi is contracting during a smile. It's also considered beautiful in the Far East, which is where they call it the AGSL treatment. You can actually put filler to create that potential result, but we are often trying to do the opposite, which is soften it. This treatment requires a slightly higher dose and covering more of the area, because you're trying to stop all of that upward pull of orbicularis oculi so that you bunch up the skin less and cause less of that bulge. The only negative I would say is if you decrease cheek elevation enough, sometimes it actually makes your smile look less real, and you effectively are not giving a true Duchenne smile, which is a genuine smile. It looks synthetic or fake, and that can be a downside of this treatment. So next I have a patient and clinician who many of you have heard of. This is Julie Bass-Kaplan, who was talking to my wife Miranda, and she mentioned that she had a botulinum toxin treatment that made her look like a psycho. Now, she would only say that. I don't think she looks like a psycho. But I am interested to try and figure out what exactly is going on here that makes Julie feel like her character has slightly changed, her appearance has slightly changed in that negative way from Botox underneath the eyes. Let's have a look at that clip.
I had Botox under my eyes here and didn't realize that my time was over for Botox under my eyes, right? Like, so every time I smiled like a psychopath. Like I was smiling like this the whole time, right?
Whenever a patient uses an analogy, or in this case, a clinician uses an analogy to describe their appearance, you must Google it because often they're capturing a whole load of complexity in one visual image. And so if a patient says, I look like a psychopath, I want to Google psychopath and see what I can find in these images, because Google actually knows what patients mean because everyone's been uploading their pictures in this way. And I can see what I can find that could potentially cause this. And what I'm seeing in some of these images is, firstly, a lot of them are wide-eyed images. So maybe Julie's eyes were too wide lower down when she was smiling. And when you normally smile, your eyes should narrow. But if you've relaxed the muscle too much, you may get essentially too much of the sclera showing when you're smiling instead of that disappearing when you smile. So potentially that was the cause. Some of these other images also might go with a medial brow drop, but that's not what she's describing, so I don't think it's that. But it's the kind of thing I might use with a patient saying, is this what you mean, or is that what you mean? Because it's often difficult to recreate. The other great learning from this is something I always talk about quite a lot with patients is there's a difference between how you look in the picture and how you look when you're actually out there in the world functioning. Because your mirror moment when you're in the mirror before you go to work and you're just having one last look at yourself is different to your dynamic function of your face. And often patients, particularly if they are on stage or they do TV work, they will pick up things that you would not see in the mirror and you don't see in your consulting room. And you need to gather that information to make better treatment plans in the future. So the other interesting thing that Julie said is that her time was passed for that particular treatment. And this is another very useful insight around many of these treatments, which is absolutely they do work, but only in certain patient groups. And it does get harder the older people get. And that's, like I've discussed in a previous video, which we'll link at the end, Botox in older people is trickier because the balance point is narrower. So you can think of it like balancing along, when you're young, Botox is a bit like balancing on a nice curved surface. There's lots of room for you to go either side and you still balance along. And as you get older, it turns into a tightrope, which means a little bit too much or a little bit too little, and you end up falling off the good result. Great treatments don't work on all age groups, and you need to know the types of patients to use each treatment and also prepare them for a time when it will no longer work. Now let's talk about some of the complications you could get from this treatment. So when I include complications, I think of aesthetic complications, so things that just look worse than having no treatment at all, but also things that can cause medical risk of some sort. So on the far end of this, and probably the least likely thing to happen, because most clinicians would not be treating patients like this anyway, but if you were to overtreat the muscle and skin laxity is insufficient enough, you can actually cause an ectropion. So that means the eyelid skin actually hangs outwards and the eyelashes emerge, and you end up with being able to see the pink part of the eye, and it's a very unpleasant look. And most patients would be extremely upset with that if it ever did happen. This would only happen when the only thing holding the eyelid against the lower part of the globe is the muscle activity itself. And that would usually mean a very old patient. So I don't think it's that likely, but it is on the list. The next thing would be the stage slightly further away from that, which is maybe a little bit what Julie was describing, which is a sense of sagging. So if you have more white showing underneath your eye, you look sallow. It's an unhealthy appearance, which is to do with what we normally associate too much white of the eye showing with, which is some sort of stress or shock, or as Julie describes it, like a psychopath. There's something about that which is aesthetically displeasing, which happens in the early stage of overtreating underneath the eyes, probably more in older people. I would say 40s, 50s and above. The next thing is a dynamic difference when you smile. So this is actually super common. It's one of the Botox looks that people realize is making them look like they've had too much Botox, is that you have relaxed orbicularis oculi muscle all the way around, except for the medial part where it's now pulling every time you smile. So you get this pinched appearance. if you think about what's happening with botulinum toxin, we've neutralized a lot of the muscles that are pulling outwards and balancing the skin and underneath the eyes, and we're left with only the muscle that pulls inwards. So the muscle pinches, the nose pinches, you get lines on the nose and lines underneath the eye, and the eyes narrow medially but not laterally, and it creates basically something that we just know to not be natural, which most patients, when they see it, won't like. And they won't see it when they're in the mirror having a look at themselves. They'll only see it in a picture or a video of them doing a natural smile. And it's this inward pull where everything gets pinched towards the center. Are there any benefits to treating underneath the eye, and would I do it? The answer is there are benefits, but it's in a very narrow patient group. I would say typically the harder you try with botulinum toxin, eventually you get some sort of weird look. Even if they don't have a proper complication, it just doesn't look quite right when you've relaxed the entire muscle. So as I get more and more inferior, I use lower and lower doses and eventually won't use any at all. And typically I prefer not treating beyond the lateral canthus inferiorly about this point. But there are certain occasions when I will treat a little bit more in certain patients with a lot of caveating. So this means small doses with a warning of the potential side effects, and allowing them alongside me to run it a little bit like an experiment. Let's try 1 unit. We'll see you back in 2 weeks. And if you're happy with it, we can do that for a while until, just be prepared, 5 years time is probably not going to suit you anymore because of decrease in skin integrity as you get older. If you want to learn a whole lot more about injection technique and a whole lot more besides, make sure you click on the link that goes with this video, because I've got something pretty big coming up soon. And if you want to go on a journey from where you are now to master injector, this may just be the opportunity you've been waiting for. So click on the link in the description.